Well, I guess for me, my interest in research, funnily enough, came about probably many, many years ago when I was in Australia. I was in my 20s. The AIDS pandemic began in Sydney at that time, and many of my close friends were stricken down with HIV and eventually died of AIDS. And it was so catastrophic that I was really compelled to try and understand how that virus could have escaped and become such a profound health issue. And I was incredibly struck by just how much social circumstance, timing and so on can sort of have a real impact on people's life or death experiences in pandemics, and that was something that I wanted to understand more about and really wanted to be able to intervene in and make a difference in. So after I'd been exposed to all of the HIV pandemic in Sydney, I decided that I really needed to go back to university and to study more and to learn more about it. I felt it was really important to educate myself around those issues. I became extremely interested in assisted reproduction. It is often the case nowadays in modern life that people have to rely on technologies in order to reproduce in ways that they didn't do historically, partially because they didn't have access to those technologies before. And I've become very interested in the sort of ethical, legal and social issues that surround assisted reproduction, and particularly how assisted reproduction and IVF treatment has been rolled out in the global south. So I've worked in India for many years, and everybody thinks, oh, India, China, surely these people don't really need assisted reproductions. They're some of the most populous countries in the world. But actually it's the case that for any people and people who are in families who want to have children, it's incredibly important for them, if they want to do that they're able to do so. And I guess I've been particularly interested in the question of how they access these very sophisticated technologies, because for a lot of them, they are not very well versed in these technologies, they're not familiar with them, and there's a lot of opportunity for them to be taken advantage of, particularly because many of them are so desperate to have children, and being infertile is so highly stigmatised in those particular societies. So I've looked into that in a lot of detail, done some big research projects in India on the rollout of assisted reproduction in fertility services across India to try and see if we can ascertain how that's being done and where there might be areas of inequality or discrimination that we might want to address. I have in recent times been doing a lot more research on assisted dying. So assisted dying is the process by which people who are in the final months of their life, because they have a terminal disease, are able to consider accessing an assisted death. And what that means is that they would be able to access a drug at the end of their life which would terminate their life with medical assistance. And I've done research, I've interviewed now over 50, nearly 60 individuals who in some way have had their lives touched by their inability to access an assisted death at the end of their life. Those tales are incredibly harrowing, and it's very difficult as a social researcher to take those qualitative interviews with those people, but I think it's incredibly important to do so. This is something that is coming up and now being debated in Parliament in the UK, and one of the things I've always been interested in is how we can translate research into policy, and the kind of research that I've undertaken with my colleagues is providing the evidence, I think, for policymakers and politicians to give a really careful and considered review of the experience of those people who have been really adversely affected by a lack of assisted dying legislation, and that would enable them to do that in a safeguarded way. And I really hope that the production of that evidence will make a difference to that debate going forwards. My trajectory to the department was a very interesting one. I was very close friends with Professor Nicholas Rose, and it was Nick's original idea to create the department here, and that was a sort of incredibly bold move, because at that time there was no department of global health and social medicine in the UK, and both Nick and I were of the view that Global health was something that was just becoming incredibly important in the world, and we really believed that we wanted to train a whole new generation of young people who would have the skills and the competencies and the abilities to really work on the forefront of these big global challenges. A lot of issues around climate change and health, around displacement, conflict and health, access to new technologies, things like reproductive technologies and so on. And we wanted to have young people to have this opportunity to be able to really understand these issues, be trained in how to address them, and then have opportunities to go out in the world and really make a difference. What's really special about this department, what's been incredibly important for me, is that it has created a space for me to do this work in that is highly multidisciplinary. That whether we're talking about my work in the early pandemic of HIV in Sydney, all the way through to the assisted reproductive work, and then through to the assisted dying work, it's clear that all of that work touches upon a number of disciplines that are key to the resolution of those issues. And what I've really benefited from in being in this department is being able to draw upon the expertise of an incredible array of colleagues. We've been able to put together some really comprehensive and well-informed approaches to the study of these particularly difficult, I think, sometimes almost intractable problems, and come up with some really creative solutions. One of the things I really love about being in this department is being able to teach. And the undergraduates and the postgraduates that I work with are the most extraordinary cohort of young people. And it's just an amazing thing to be training a new generation of young people who want to get involved in that work. And I was really struck and actually humbled when I gave a lecture, which I often do on some years of the course, around the early years of the HIV pandemic in Australia. And the students were dumbstruck by some of the things that I said about how gay people were perceived. Ronald Reagan had the idea of putting people in almost like the equivalent of sort of concentration camps in the desert who had HIV to keep them corralled off from the general population because of concerns about contamination and the spread of the virus. And many of them came up to me afterwards and really wanted to talk to me about the lecture, and we discussed that and the parallels between that historic experience and the way some people have experienced COVID in London throughout the recent crisis. To me, it was incredibly energising to get that sort of buzz of engagement off the students who really wanted to understand the history of these events, but also wanted to connect it in with their own personal experience. So I learned a lot from them and got a huge amount from their energy and engagement with the whole issue. And that's one of the things I really love about being here and working with that very interested and engaged student body. Working in this department has been both a privilege and a kind of honour for me during the last 18 months in particular, because I feel like I've come the full circle, ironically enough, from my work on the HIV pandemic in Sydney, during the early 80s, all the way around full circle to the COVID pandemic here in London. It's just been one of the incredible privileges of my life to work with the people that I work with, who are just some of the world-leading experts on these topics. And I learn from them and I discover things from working with them every day. And they really improve and nuance my understanding of all these issues. In the end, we're all here to do something useful during our lifetime, I hope. And for me, one of the really important things to do is to try and capture and gather all that knowledge and evidence and testimonies from the people that I've worked with, and really use that, mix it with the expertise and the knowledge of my colleagues to create these applied creative solutions that can be passed into policy and made workable in the world in ways that will really benefit all echelons of society, and those people particularly who are most adversely affected by these issues.